everyone. I'm in conversation with a wonderful senior of mine today, Vidar sir, who is actually pursuing his third year of Bachelor's of Physiotherapy. So, this conversation is for all you physiotherapy students, as we will be talking about the do's and don'ts as a PT student. So, hi, sir.
Hi, thank you so much. I'm really privileged to have such a good introduction. For all the viewers, I'm not that good of a person, as she mentioned. So we will be discussing physiotherapy related problems which students have and the other issues and some advices which and some discussions which can be used by other fellow students.
Okay. So, starting with the biochemistry, pathology, and pharmacology, micro. So, starting with that.
Okay, so talking about first year subjects, as you have mentioned all of them rightly. So your main subjects or the subjects which are going to be a crux are anatomy and physiology. Other subjects are going to make a base for you to climb up so that you can understand various different subjects in coming years, like let's say medicine, let's say surgery. So you do require basic understanding of pathology, of pharma, and microbio. As such, the depth is not that much required, but when you have to develop an understanding of, let's say, a case of surgery, or let's say a disease in medicine, your basic understanding for these subjects, these basic fundamental subjects in medicine is very important. Pharma, the drugs, how a drug works, kinesiology of how, what are the kinetics of drugs, how drugs are acting, and how drugs wash off, metabolism of the body. These are very fundamental things. As a physiotherapist or as an occupational therapist, there can be your argument that we are not prescribing drugs and you should not be reading about them, but your patient is taking something which is affecting his condition and you're treating him holistically. So just ignoring a medical treatment cannot be your way of judgment. आप उसको उस तरह से नहीं रख सकते हो. You should be appreciating or else giving it its space. ठीक है, he is taking his medication, you should know. So pharma is a very important aspect. Pathology, understanding why a disease is happening is very important. Let's say by giving an example, if you're reading about rheumatoid arthritis, so if you don't know what rheumatoid arthritis is, how it starts, या फिर किस चीज से वो progress बढ़ता है, कैसे progress होता है, and you want to treat that patient, it's not possible. So basic fundamental pathology of a problem you should be knowing. But coming to the main subjects, very important, anatomy and physiology. There is no way you can compromise these two subjects. You can go for see, passing the exams is very easy when it comes to a college like IPH, because you have a fixed pattern in external examination. Though out of 7 questions, you have 7 questions and you have to give 5 answers. So it's an easy way. It's a repetition. Always it's repetitive. तो हो सकता है कि 7 में से 5 पहले आए हों और आप prepared हों और आप कर सकते हैं. But that only limits your knowledge to those 5 questions. Anatomy cannot be limited to even 5 topics or let's say to 50 topics.
Yeah.
It's such a vast subject जिसमें आप कुछ भी पढ़ सकते हो, कुछ भी. You have 100 of ligaments in the body, so many ligaments, so many joints, and you cannot and you should not limit your knowledge to n number of questions and n number of topics. Physiology, whereas, is providing you the functioning. Anatomy provides the structural basis कि आपकी body में ये ligaments हैं, ये ligament यहाँ से यहाँ है. Whereas physiology provides the functioning of the body कि आपकी body function कैसे कर रही है. How is your body producing the muscle tone? There is a muscle. You will get to know the muscle in anatomy. How is that muscle producing a tone? What is a muscle tone? half of the students, majority of students, they by the end of the year they are not able to figure out what is muscle tone, what is spasticity, what is increased muscle tone, what happens in upper motor neuron lesion, what is lower. These are very basic things. By the end of first year, by correlating anatomy and physiology, you can figure out half of the musculoskeletal diseases. You can, but that only gives you a wide variety and a spectrum, but not in detail. As you progress, you understand basic things, but as you progress, you're shown an umbrella. आपको एक umbrella दिखा के बताया जाता है कि ये चीजें होती हैं, but जब आप आगे बढ़ोगे तो आप realize करोगे, ओ ये तो बहुत बड़ी चीज है. Rheumatoid arthritis for a first year student is a condition. That's it. For 1, 2, 3 lines, that's it. But when he understands what are the structural changes happening, तब उसको पता लगता है कि हाँ यार, this is something, this is entirely I can read books on. सिर्फ एक एक चीज के ऊपर you can read books on. So first year में physiology should be a go-to. When it comes to books, many of the students by now they are using many books. So you can use AK Jain. AK Jain is a very good book. You can use other books also. I personally used AK Jain, as well as I used Guyton and Genong. Guyton also, Genong less, but Guyton. Guyton, very good book, very elaborate, very specific. You can find anything in it. मतलब आप अगर physiology पढ़ रहे हैं and you are searching for something, you can find it in Guyton. Then, but again, Guyton and Genong are the review books. So you should be going for one fundamental book, जैसे AK Jain. Then review books पे आप जा सकते हो. BDC is for anatomy, very important. But BDC is a very मतलब हम लोग, we had the privilege to be students of Dr. Krishna Garg. She was an amazing person. Like she was called the goddess of anatomy, and she is the goddess of anatomy because of her nature. उनका इतना अच्छा teaching style, इतना passionate अपने subject के लिए होते थे. I guess that is one of the things. 27th 29th batch IPH, we were the last students जिनको उन्होंने पढ़ाया. She was very thorough, और हम लोगों के अंदर जो passion है anatomy को लेके, we are dedicated, and हमारा मतलब courtesy उन्हीं को है. सारा batch का anatomy का courtesy to Dr. Krishna Garg. तो आप BDC पढ़ सकते हैं. But the one lacking point is BDC में आपको realistic diagrams नहीं मिलेंगे. There are descriptive diagrams, but realistic नहीं. उसके लिए you should go for atlas. Anatomy पढ़ रहे हो और आपने कभी atlas नहीं पढ़ी है तो you are doing it wrong. ठीक है, आप atlas के बिना anatomy नहीं कर सकते हो. आपने अगर bone कभी देखी नहीं है and you want to memorize that bone, तो not possible. So go through the atlas if you're studying bones, you're studying structures, you're studying let's say femoral triangle you're studying. If you're not seeing femoral triangle, how it exists, कैसे उसके structures होते हैं, तो फिर बहुत बहुत ज़्यादा chances हैं that आपका understanding एक line diagram जितना ही रहेगा. Whereas when you brush it with your anatomy की atlas या फिर any book which has real life diagrams or cadaver cut sections अगर हो उसमें, तो बहुत बहुत अच्छा knowledge base के लिए रहता है. और practical hands on. See, why this is important? As a physiotherapist, you will be palpating the patient for different features. Let's say you're palpating cervical spine, you're palpating thoracic spine. So अगर आपको उन structures का palpation सीखना है तो anatomy सीखनी पड़ेगी. आपको पता होना चाहिए कि स्पाइन का पीछे जो एक्सटेंशन है, प्रोसेस है, स्पाइनस प्रोसेस है वर्टेब्रा का, वो कहाँ पे है. वो यहाँ पे लाई करेगा तो उसके आसपास के स्ट्रक्चर्स कौन से हो सकते हैं. इफ यू डोंट नो बेसिक एनाटॉमी तो बहुत प्रॉब्लम होगा. सो एनाटॉमी के लिए गो फॉर एनी बुक. BDC is a very good book, but go for realistic diagrams also. Keep brushing up with your latest findings. हमारे साथ दिक्कत ये होती है कि many students they go for a very static knowledge. जबकि हमारा कोर्स itself, may it be PT, may it be OT, it's a very dynamic course, it's ever changing, and you will notice it कि आप पेशेंट पे एक मोडालिटी या एक तरह की थ्योरी नहीं लगा सकते हो. It's always going to be multiple theories और multiple disciplinary approach लगाओगे तब जाकर शायद पेशेंट पे कुछ आउटपुट आ सकता है. Because you're not invading, mind you, we as a therapist, we are not invading into the body, we are working from the outside to function and to correct the inside of the body, which takes a lot of effort. तो आपको multiple चीजों को ध्यान में रखना पड़ेगा, उसके लिए एक चीज को यूज करके नहीं हो सकता है. सेम आप स्टैटिक चीजें 4 लाइन किसी ने 40 साल पहले लिख दी वो पढ़ के नहीं हो सकता है. लेटेस्ट रिसर्चेस पढ़िए. और फर्स्ट ईयर के एंड तक इफ यू आर कॉन्फिडेंट विद योर एनाटॉमी एंड फिजियोलॉजी, हाँ बाकी सब्जेक्ट्स आपको थोड़ा सा पुश डाउन कर सकते हैं थर्ड ईयर में, यू कैन रियलाइज, बट दीज टू सब्जेक्ट्स कैन पुल यू आउट और आप आगे ज्यादा अच्छा मैनेज कर पाएंगे. सो माय एडवाइस वुड बी concentrate on your physiology and anatomy, don't forget the other subjects, but एक बैलेंस होना चाहिए. अगर कोई चीज बहुत इंपॉर्टेंट है तो उसको बहुत इंपॉर्टेंट की तरह ट्रीट करिए. उसको आप बाकियों की तरह ट्रीट करेंगे तो फिर योर अंडरस्टैंडिंग विल बी द सेम. एंड ऑल द हाँ जी.
Go on.
So students who go in depth in pharma, in patho, yes, you're doing good, you're studying it thoroughly, but my advice is कि आप अगर pharma या patho पढ़कर you're giving it 10, let's say you're giving it 10 hours in the week to these two subjects, you should be giving 20 at least to other subjects like anatomy or physiology. If you're not giving 10 और आप उसको 5 भी दे रहे हो तो शायद चलेगा, लेकिन अगर आप सबको सेम लेवल पे रखकर अपनी नॉलेज को बढ़ाना चाहते हो तो नहीं हो पाएगा. इट इज अ मोर डिमांडिंग सब्जेक्ट. इट्स योर फंडामेंटल सब्जेक्ट, सो प्रायोरिटाइज विद द सब्जेक्ट. एंड
even I would agree with this. Like from my experience of nearly about like abhi hamara bhi first year khatam hi hone wala hai, and 2 points I would also like to just highlight from sir's point of view. First, the realistic diagram thing. I think that line diagrams examination point के लिए draw करने के लिए बहुत आसान होते हैं from BDC, but the realistic either you like I personally love gray. तो ग्रेज में जो डायग्राम्स होते हैं दैट एक्चुअली हेल्प्स मी अंडरस्टैंड कि ओके दिस इज द थिंग, ये एनास्टोमोसिस अगर हो रहा है तो ओके द आर्टरीज आर हियर और द नर्व्स थिंग इज हियर, और अगर कहीं पे कोई सॉर्ट ऑफ क्या, सो दैट इज वेरी हेल्पफुल एंड इट्स अ लॉन्ग टर्म रिमेम्बरिंग के लिए भी बहुत अच्छा होता है आई फील. एंड सेकंड पॉइंट एज सर मेंशन इन द लास्ट थिंग अबाउट द सब्जेक्ट बैलेंस थिंग, वो गलती थोड़ी मैंने भी की थी बट luckily I got back. पहले I thought that pharma and because there was so much thing going on and we had this online is a thing, तो वैसे भी anatomy and physiology में वैसे भी दिक्कत आ रही थी समझने में. So initially I also neglected these two, but then थोड़ा आपको